Aspirin, also known as acetylsalicylic acid, has a long history and has been in use for its medicinal properties since ancient times. In this video, I will tell you the story of aspirin, how it was discovered, and exactly how it works in your body. My name is Hafiz and I'm a cardiologist training in London. If it's your first time here on the channel, I give tips on how to keep your heart healthy and explain heart conditions in a way that I hope is easy to understand. If that interests you, then click on the subscribe button and bell icon so you get notified every time I release a video. Aspirin's active ingredient, salicin, is found in the bark of willow trees and other wild plants. It's actually how it was first discovered over 4,000 years ago, when medicines were derived from the bark of the willow trees to relieve pain. It wasn't until 1897 when the pharmaceutical company Bayer developed a synthetic form of this compound and called it aspirin, which soon became synonymous with the drug we use today. Aspirin is a class of drug called non-steroidal anti-inflammatory drugs, or NSAIDs for short. Aspirin is a versatile drug and has three main modes of action. It's an anti-inflammatory, pain reliever, and reduces risk of blood clots. In cardiology, aspirin is mainly used to reduce your risk of getting blood clots. A blood clot is made up of fibrin, which is long strands of protein that form a net. Platelets and cells clump together and stick to this net, forming a clot. Aspirin works by interrupting the clotting process, and it does this by stopping the enzyme called cyclooxygenase 1, or COX-1, in the clotting cascade. This makes platelets and cells less sticky so they can't clump together and form a clot. This is important because it is this clotting process that leads to a heart attack or stroke. In cardiology, aspirin is administered in two main doses. Typically, a daily low-dose aspirin, 75 milligrams in the UK, is prescribed for people who have a cardiovascular disease, such as peripheral arterial disease, or who have had a heart attack, or certain types of strokes. Larger doses of aspirin, usually 300 milligrams, is given immediately after a heart attack. In this emergency situation, it is given as a one-off single dose followed by the maintenance dose. In this case, it is combined with other antiplatelet medications such as clopidogrel or ticagrelor to increase its efficacy. So where is the evidence for aspirin in heart disease? It was really the 1989 landmark Physicians' Health study which showed that aspirin reduced risk of a heart attack by 44%. In cardiology, aspirin is also used to treat inflammatory conditions such as pericarditis, which is inflammation of the lining of the heart, and Kawasaki disease, which is a vasculitis, inflammation of the blood vessels. This is because the cyclooxygenase enzyme that I mentioned before is also important in the inflammatory process. In the 1960s and the 1970s, scientists in Sweden and the UK showed that aspirin reduced release of inflammatory chemicals called prostaglandins. In 1982, this discovery won the researchers a Nobel Prize in Medicine. And because it is implicated in the inflammatory process, aspirin helps with inflammation, pain, and fever. It is also used in other inflammatory conditions such as rheumatoid arthritis. As with any medication, there are side effects to consider. The most important side effect to be aware of with aspirin is an increased risk of bleeding because aspirin reduces the risk of platelets sticking together. Generally, these bleeds are minor, but occasionally patients may experience severe bleeds. These are most commonly in their stomach or intestines, where they can cause substantial and occasionally life-threatening blood loss. They are more likely to happen if you have a stomach or duodenal ulcer. Symptoms of this type of severe bleed include upper abdominal pain, passing blood, or black stools, or vomiting blood. If this happens, it is important to seek urgent medical attention. Severe bleeds may also occur in the brain, leading to a stroke. These are rare, but potentially very dangerous and severe, and explains why aspirin is not recommended to be taken regularly by otherwise healthy people. Occasionally, people who have asthma find they are sensitive to aspirin and that it can cause an asthma attack. This is called a hypersensitivity reaction, and it's not entirely clear how this occurs. So, for these reasons, it's important to discuss with your doctor before starting regular aspirin yourself. So I hope you have a better understanding of how aspirin works and appreciate how from its humble beginnings, it has really transformed modern cardiology practice today. Do you take aspirin? How has your experience been with it? Tell me in the comments below. Thank you for watching, and I'll see you in the next video.